We have this patient that was presented to us. She was like a 40-year-old woman, and she was presented as a resistant depression. But when she gave her clinical history, there was something really weird in this kind of title that she got, because she described that when she got medications, initially they helped improve her mood, and over time she got depressed more and more. She also described having ECT, electroconvulsive therapy, and she described that in the beginning, the few first sessions really helped her and made her feel better. And over time, her mood was depressed. Now, this is counter to the phenomenology that we know about ECT and medications. We know that initially they don't help. But over time, there is increase in effect and antidepressant effect. So, what's behind it? Going deeper into the clinical case and observing the medical history and the developmental history and psychological developmental history, there is a story of being abused as a child, problems with upraising, problems with organization of personality, and actually there are evidence that she probably has some kind of traits that are related to being neglected, being sensitive to rejection, and being responsive to attention, being center of attention, something along the lines of narcissistic personality disorder or narcissistic traits at least. And this could explain the phenomenology that we see. It could explain why in the beginning, when you have a lot of attention from the clinician and the initial therapy, then this attention, if you have a narcissistic personality disorder, helps you in the sense that you get feedback from the environment and you have elevated mood. And over time, when the patient is becoming just one other patient like the others, then there is less attention, and that would explain a response to being neglected or not having enough attention, and then the mood goes down. So this personality disorder can explain why she's reacting in the opposite way to what we know about medications and ECT. Also with the ECT history, she said that initially it helped her a lot, and the story around it that she got a lot of attention, people were around her, people were asking her how is she feeling, and so on and so on, while over time they expected the ECT to do its thing, and she got less attention, she was sensitive to rejection, and that's why her mood goes down. So this patient was presented to us as a candidate because she has, let's say, a resistant depression, she was a candidate to VNS, vagal nerve stimulation. And I think that before we go to give this title and before we go to this type of interventions, we should really be good in phenomenology in order to understand the next level, the deeper levels that can explain treatment resistance in this sense. So actually what I thought she needed was a good, effective, hard to get psychotherapy instead of VNS.